is the webinar is on cold, flu, COVID, RSV season. As we head into the colder months, it's important to stay informed about these common respiratory viruses and how we can protect ourselves and our community. Today, we will share key updates, prevention tips, and unavailable resources to help you stay healthy this season. Uh, Today, we are so excited to present Dr. Latif Murshi. Dr. Latif Murshi is a family and ER physician based at Scarborough Center for Healthy Communities. Dr. Murshi is the founder of the widely acclaimed Health Facts Clinic, a groundbreaking initiative that addresses vaccine hesitation through physician-led phone conversation and has now broadened its scope to include cancer screening, medication, diabetes, chronic disease, and another question that maybe you have regarding your health. His work with Health Facts Plus has garnered national media attention and serves as a blueprint for engaging communities in health literacy. Dr. Murshi is a lecturer of the University of Toronto, where he has created a novel health equity curriculum for resident physicians based on the tenets of experiential and transformative pedagogy. He is the founder of a non-profit organization, Stand Up for Health, which delivers immersive learning experiences to train healthcare workers in health equity and advocacy. And by night, Dr. Murshi showcases his artistic flair as the lead vocalist of the indie rock band Parachute Thief.
Thank you, Mercedes.
Thank you so much, Doctor, for having us. We are excited today for the presentation. So when you are ready, the floor is yours and disappear.
Okay, awesome. So I'm going to now share my screen. Uh, and hopefully I remember how to do this. Uh, Hold on, let's do that. How does that look?
Great for my
It
end.
works.
Yeah.
Okay, all right, excellent. So thank you, Mercedes. We're back at it 2 days in a row. We had a talk yesterday about RSV, and today this one is for the community, and it's about respiratory season since it's October. So respiratory season, what are all these respiratory viruses that we're talking about? Well, we're talking about colds, flus, RSV, and COVID. Those are the main things we're going to talk about today. And this is geared towards the community, so we're going to make sure that everyone can understand everything. Okay, I want things to be very clear, and I want everyone to feel like they fully understand. And we're going to have questions at the end of this session. So, and then I always want to remind everyone that VaxFax Plus, which you see this neat little logo there, or Health Facts, as it is now called, is a place where you can talk to a physician one-on-one, confidentially, anonymously, about any questions you have about your health. And yes, we started out with a focus on vaccines, but now this is broadened and you can ask anything. So today we're going to be talking about all kinds of topics, and luckily there are vaccines for most of the diseases that we're going to cover today. So let's get to it. So To understand respiratory illnesses, we need to understand the respiratory system. So this is what it looks like in a diagram format. Oxygen, air. So oxygen is a component of air, right? There's also carbon dioxide and nitrogen in the air, and we breathe it in, ideally through our nose. We can also breathe through our mouth, but there is less filtration going on in the mouth, so we prefer it through the nose. These are all parts of your respiratory system. The air goes through your trachea, which is your windpipe, which you can see over here. Can you see my mouse, by the way? Does it show? Yeah. Okay. So then, so then the air goes through your trachea, your windpipe, and then it goes into both lungs. And your lungs expand and contract every time you breathe, right? So when you breathe in, your lungs expand because you're pulling air into your lungs. And then when you breathe out, your lungs contract, and it's basically pushing the air back out into the world. And that's how you exchange gases. So oxygen and carbon dioxide, and your body uses the oxygen to uh, basically give your body fuel, let's put it that way, into the blood. Okay, so uh, it's it's a source that your body uses. So let's continue along. So anyways, the point is that these infections affect this system mainly. But if this system, respiratory system, which is a very important system, if this is affected, then it can have, you know, bad outcomes for other systems like your circulatory system, which is like your heart or your kidneys, these kinds of things. So everything is connected. So let's start with the easiest thing, okay? The lightest, softest thing, which is a cold. A cold is a colloquial, everyday term. And this is when you have a viral infection, which is mostly kind of just like runny nose, maybe a bit of sore throat. Uh, so it's of the upper respiratory system. Okay. So if you look here, it does not involve the lungs. Okay. It's mostly a virus that stays up here and just causes some light damage up here, but you recover relatively quickly. You do not get a fever. You do not feel bedbound and super tired. None of that. Okay. It's just a cold. You get the sniffles and the cough and some congestion, and you blow your nose, and you're generally fine. Um, the common cold is generally caused by a type of virus that we call the rhinovirus. Um, there's over 200 different viruses that can cause a cold, and many of them, uh, about half of them, we call rhinoviruses. Okay, so but there's so many different viruses, and we don't really bother like knowing, oh, this is, typing every single virus because, again, as I said, the common cold is not what's going to put you in the hospital and make your kidneys fail, etc. So it's just important to know this because we want to differentiate this from the more serious things. So that's why we're still going through this. It's important to understand. So how does it spread? Well, it's a respiratory virus, and a lot of respiratory viruses spread in similar ways. In this case, through contact, right? When you touch something that has droplets on it, respiratory droplets, like when you cough, then you cough on your computer, and then you touch your computer, and then later touch your mouth. Well, then that's how it can spread. Or let's say you cough on your hand, then you touch a doorknob, and then someone else opens that doorknob and then touches their face. Um, so you can see like how contact can happen, right? Droplet is when the droplet of your cough, like let's say you're within 2 meters, it can actually go directly into someone else's mouth. A little tiny droplet, right? Sometimes we can't see it. And airborne is when uh, the virus stays in the air for a period of time because it's so light that it can be suspended in the air and then it can be breathed in. And this is famously how COVID is spread. So you can get a cold. Everyone's had a cold here before, and this is when other people are coughing around you and sneezing, and then you're touching the same things and you're not washing your hands enough by, you're contacting things that are infected or being too close to people that are infected. And who can get a cold? As I said, Anyone can get a cold. We've all had colds. The people who get more sick with lighter viruses are children and older adults, elderly people, because of their immune system. Children, their immune system is immature. It's so undeveloped that it's not hasn't seen these viruses before. When you're in your adulthood, you've been sick before. You've seen a lot of this stuff before, and that's why your immune system is more prepared to fight it off. You also have more physiologic reserve, which means that your body is generally stronger and better able to fight off invaders. And then older adults, well, they're getting older. So now their army of soldiers, the antibodies are getting a bit weaker and they're a bit slower. So that's why viruses can affect their immune system. Okay. And then we also know that, and you might have just noticed this through your own experience, that you can get a cold or you tend to get more of these kind of viruses in the fall and winter when it's cold outside. And maybe that's why it's called a cold. So in these situations, we know that people are indoors more often because who wants to freeze outside? So we're staying indoors. Then that means we're crowded more. There's less ventilation, right? Because outside, you're in the whole, the sky is blue and, you can't, it's open, right? So there's a lot of great ventilation and uh, it's a completely different situation when you're indoors and all the air that you're breathing is the same air that the next person's breathing all the time, right? So that's why we want to improve the ventilation of our indoor spaces as well. So any place that is crowded is going to increase the spread of infection because there's more likely to have an infected person in the space, and then they're more likely to be close to you. Okay, so as we mentioned, symptoms of a common cold are irritated nose, runny nose, sneezing, bit of sore throat, and then maybe later you might have more of that going on and you feel a little bit worse, but this is still on the milder side of the spectrum, okay? Now, this is in contrast to the flu. The flu is very important to understand because this is another virus that also attacks the respiratory system. Your, your the same system I showed you the diagram at the beginning. And this flu usually lasts, let's say, 1 to 2 weeks. And when you get the flu, it feels like you've been hit by a truck. Like you feel really tired and run down. You feel like you don't really want to get out of bed. You often have a fever. You feel really tired. You can also have the runny nose and headache. You might feel a bit nauseous, these kinds of things. And you can imagine if this happens to someone who is more vulnerable, like an infant or an elderly adult or someone who's immunocompromised or someone who has kidney problems or a different lung problem or heart problems, then it's going to cause some problems and they might end up in hospital. So this is a cause for hospitalization for some people. So as I mentioned, what makes immune systems vulnerable in the first place? Well, if your immune system is weak, you're more likely to get ill. So if you're immunocompromised, like if you're on a medication that is actually suppressing your immune system, and we have to give these medications for people who have had transplants, for example, or maybe you're on chemotherapy, your body is weaker, right? When you're trying to fight cancer and you're getting medication that's also really aggressively fighting the cancer, it makes you weak. As if you're older, right, or if you're really young, if you're stressed, you just experienced something traumatic or even emotionally, um, someone you had a loss in the family, these types of emotional stresses. Maybe you just wrote an exam. You might notice that you get sick around these times because your body's going through so much stress that your immune system is weakened in these moments. Oh yeah, and also your nutrition matters, right? So if you're not eating healthy food or if you're not eating enough, you're in a vulnerable position. So for these types of viral illnesses, we want to do something called supportive care to manage. the illness. Okay. So we're not talking about prevention right now. We're talking about if you actually have the illness. So let's say you have the flu. Okay. We're not going to give you like an antibiotic. No. Antibiotics are for bacterial infections. This is a viral infection, which means the antibiotic is completely useless and we should not be giving it. So then how do we fight the virus? Well, it's your immune system has to do the work. And so what you need to do is you need to support your immune system. That's why we call it supportive care. What is that? It's rest and fluids. So you need to stay home from work so that you can rest. You also stay home from work or school so that you don't pass this infection on to other people. You want to make sure you're having fluids because then you stay hydrated. Because if you get dehydrated, you are going to feel much worse. Your headache's going to get worse. Everything's going to get worse, and you might end up in the hospital. So make sure you're drinking lots of fluids. You'll also be going to the bathroom maybe more, but that's fine. Just keep drinking fluids because you need to stay hydrated. And if you're going to the bathroom a lot, that's a sign that you might get dehydrated too. So you need to drink even more fluids. Okay, so just keep drinking fluids. Very important. And then the Tylenol or Advil, these are both medications to treat symptoms like a fever. So the generic name of Tylenol is acetaminophen, and the generic name of Advil is ibuprofen. So either of these is helpful for treating fever. And let's say you had a headache, that would also be helpful. Okay, so these are for your symptoms, just so you feel better. But these are not going to actually treat the virus. They're not going to kill the virus. They're just going to make you feel better, which is also important. And if you feel better, then you will end up, you know, you're going to be able to drink fluids and you're just going to be able to fight it off better with your own immune system. Okay, symptoms of the flu. So, as I said, flu often has fever, often has headache. You feel like muscle aches and pains. You can feel really tired, fatigued, weak. You could also have runny nose, sore throat. You could even have chest discomfort. But if you have chest discomfort without any of these things, then we're thinking of other things. But in the context of all of these things, then yes, we are thinking more of the flu. But again, it depends on your age and your risk factors. We don't want you to just think, oh, I have the flu, and you're actually having a heart attack or you're having a pneumonia, which is a lung infection, right? Cough, shortness of breath. These are all typical flu symptoms, especially when they're together. Okay, so now let's switch gears a little bit to RSV, which was actually the topic of my staff webinar yesterday. So, in simple terms, RSV is another respiratory virus, okay? It's just a little bit different because this one, it specifically is harmful for certain populations. Those are elderly people and babies. Okay. And also like anyone who's immunocompromised, that kind of thing, everything affects them. So they always have to be on the watch. But RSV is called respiratory syncytial virus, and it also affects the lungs, as we said. And when you're a baby, the more if you get infected with this, the way it could go is something called bronchiolitis. Okay, so that's the bad thing that we don't want the babies to get. And that's like a chest infection, let's put it that way, of the airways in the chest. Okay. And that's for babies. And then for adults, right, older adults, we want to prevent pneumonia, these kinds of complications from RSV. And RSV, just like the flu, is seasonal. It it has a season and it's typically the fall and winter. So we say November to April is our RSV season. So RSV, very common. Most children will get infected with this. Okay, so it's just a matter of how are they going to handle it. What are the symptoms? Well, it's kind of like the same cold and flus that we've talked about, right? It's it's an infection where it's affecting the respiratory system. So again, it's going to look similar. It's going to be a cough, runny nose. You could have a fever. If it's affecting the lungs more and it's tightening the airways, you start to hear musical sounds of the breathing, which is called wheezing. A young infant might have lower appetite, lower energy, and be irritable and fussy. So those are things to make you think about RSV. And it's spread in the same way. Again, these respiratory infections often are, they have similar symptoms, they have similar spread. So that's droplets. That's when people are coughing and sneezing nearby. That's touching surfaces that have these droplets and touching your face. So this begs the question, how do we stop the spread of these types of things since they're all spreading in similar ways? The answer is wash your hands, okay? Frequently and properly. So that means use soap and water and really get in there. Take your time, do it properly. Watch a YouTube video on it if you don't know exactly how to do it properly, okay? But you really want to get in all the spaces, in the crevices, do a good job, do it frequently. And you also want to keep a distance from people who are sick. Uh, if you are sick, you should probably be staying home. If you're coughing, you should do it into your elbow like a vampire. Things like this. We all know this. This is just a reminder for you. So, you know what's even better than all that is prevention, my favorite topic. So, for RSV, we have a vaccine. We also have one for the flu, by the way. We will get to that. But the RSV one is the most exciting new thing that we have on the block. So, I use the word immunization and then use the word vaccine. And why am I changing these words and why am I bringing this topic up? Well, you see, there's a difference, okay? Immunization is the act of protecting an individual by them obtaining antibodies, which are soldiers of your immune system. Now, the way that they obtain the antibodies is the key of whether it is a vaccine or whether it's something else, okay? At the end of the day, what matters is they're immunized. You, as a patient, you're immunized. Great. You have the antibodies. Fantastic. But when we're using this terminology, a vaccine is when we are giving you something that is going to stimulate your immune system to then create your own antibodies. And then if you have your own antibodies, you have been vaccinated and then you hopefully are immune. Okay? If we just give you the antibodies directly, you're still immunized, but it wasn't a vaccination. Okay? So it's just a technical term, and you'll see why it matters, why I'm telling you this today. Okay, so we have vaccines for RSV. There's three of them now. A lot of companies are coming up with these, and that's good because that means they're competing with each other, and hopefully we can get lower prices, and hopefully we can pick the best one. And so far, it seems like all three of them seem to work equally well. Okay, so it doesn't matter which one you get. They're all safe as well. If they weren't safe, they would not be approved by Health Canada. So these have been fully reviewed and approved by Health Canada. They are all safe, these three vaccines. These three vaccines can be given to any adults 75 plus, or if you are 60 to 74 and you have a high risk condition, then you are also eligible. If you got a vaccine for RSV last year, then you do not need to get a vaccine for RSV this year. Right now, there's no evidence to show that we need to be giving boosters every year. But again, this is a new program that's come out in the past couple years. So we're going to be following the evidence and seeing what we need to do in the future. So that might change in a year or two. Who knows? Let's see. Also, if you are pregnant, then if you're between 32 and 36 weeks, you can also get the first vaccine on the list, Abrezvo. That's the only vaccine that is approved in pregnancy. Has to be between 32 and 36 weeks. But wait, there's another option for pregnant women. So it's called Beyfortus. And this is a monoclonal antibody injection that the baby receives when the baby is born. So instead of giving a vaccine to the mom in her arm when she is 32 to 36 weeks, so let's say we gave the vaccine to mom, okay? She's 34 weeks. We give the vaccine in her arm. Now her immune system is stimulated. She's making all these antibodies. These antibodies are now going to go through her placenta, and the baby is going to have the antibodies. Then when the baby's born, the baby's protected against RSV. Fantastic, right? Great. Okay. So that's a vaccine. That is passive immunity for the baby because the mom did all the work to make the antibodies. The baby received the antibodies, and now the baby's protected. Beyfortus, on the other hand, is a different method of receiving the same result. Beyfortus is when the baby is born, and now we take this Beyfortus product, the monoclonal antibody, and we inject it into the baby. And we're basically just giving the baby the antibodies. So once again, it's passive immunity for the baby because the baby did no work and received all the antibodies and is now protected. And this is considered an immunization, but it's not a vaccine because, again, the baby did not make their own antibodies. So that's why I differentiated the words. But at the end of the day, they're both good. Okay. And actually, sorry, there's a typo here. Let me just fix this. Boom. Okay. So we'll get to this in a second. The point is, um, babies born this year can get the Beyfortus product because this would be their first RSV season. If you were born, let's say in June, then you would go to your primary care provider, pediatrician, family doctor, midwife, and they will get Beyfortus for you. If the baby is born, let's say a month from now, it's already going to be RSV season, then in the hospital, they will give Beyfortus to the baby. Let's say they're born in February. Well, that's also during RSV season, and they will get Beyfortus in the hospital. Now, what if you have a baby that's 1 year old? What if they were born a year ago? Are they eligible? No, unless they're a high risk baby, they have some sort of lung problem, for example, then they are eligible up to 2 years of age. Okay, so now I want to just tell you a little bit about this decision that a lot of pregnant women are thinking about making right now. And the decision is, should I get this RSV vaccine or should I just wait and give my baby Beyfortus when the baby is born? I hope you had this question in your mind because this is what I've been talking about for so long now. So it turns out that Beyfortus is slightly better at preventing RSV in babies than the Abrysvo vaccine. However, they're both really good. Okay, they're both way better than doing nothing. So if you got the vaccine and you're a pregnant mom, that's great. Great job. But if you're still deciding, I would recommend Beyfortus just because, as you can see, it's 83% lower odds of a RSV related hospitalization, whereas with Abrysvo, it's around 75%. Okay? So they're both really good, better than not doing it, but Beyfortus is a bit better and therefore is recommended by NACI. It's our pride and joy. And with either of these options, you have about 6 months of protection, which should last the baby for the RSV season. And side effects, typical side effects of vaccines or any immunizations because the immune system is getting activated. So just, redness at the injection sites, a bit of swelling there, and maybe a little bit of just irritability or maybe a little bit of fever. But mild side effects, these are totally safe and effective and recommended. Okay, let's move on to COVID. I hope you haven't forgot about COVID. So, COVID is a very contagious virus that luckily has gotten milder for most of us, but some people are still highly affected by COVID, and we do need to take it seriously. Just like how the flu puts children and elderly people and people who are have weakened immune systems in the hospital, so does COVID. And there's different variants of COVID that are constantly um, kind of coming out because this virus is mutating so much. So if you remember this Omicron variant, we are still in like that is the parent of all the current lineages, all the variants of Omicron that we are of COVID that we are currently seeing, and we're seeing patients being infected with. Okay. And they're categorized in these different with different nomenclatures. So there's different terminology that we use about the different strains, but that doesn't matter right now. The point is that COVID is still around, and they've updated the vaccine, which I'm going to get to in a second. Okay. And as I mentioned, COVID again is spread through airborne droplet and less so by contact. So COVID is very contagious because it can suspend itself as a virus in the air. So when you are indoors, there's a higher risk of COVID. When you're outdoors, there's a low risk of COVID, which is why if you're in a crowded place indoors, you should wear a mask, especially if you are like a vulnerable person. Um, but again, this is up to your comfort level, and you have to think about your own, um, what's going on with your medical conditions and this kind of thing. And this is something that we can also talk about. Okay, and I'm sure you know with COVID, similar symptoms again. The difference is with COVID, you also can have this thing where you lose or decrease your sense of taste or smell. But again, it's similar symptoms to it could be like flu-like symptoms where you're really feeling bedbound and really fatigued and really, really tired, headache, this whole kind of thing. Or it could be more cold-like symptoms if you kind of get lucky. But one thing to keep in mind is the reason why we really want to prevent COVID is not because the symptoms of COVID are going to kill you, but firstly, we want to lower the transmission because we want to protect everyone. Secondly, is why get sick when you could just prevent it or lower your chance of getting it? Thirdly, is you could have a mild case of COVID and then you end up with something called long haul COVID syndrome. And you definitely do not want that because that's when you get a headache and brain fog and these kinds of symptoms for months and doesn't seem to go away. It's very annoying and stressful. And you can imagine if a kid got that, well, those 6 months, let's say, could be like a quarter of their life, right? That to them it's a big deal. It affects their development. So you want to prevent this, okay? This is why I still recommend vaccination of COVID because we know the vaccine is safe and it's effective at least lowering the risk of COVID. So why not get it and lower that risk of both COVID and long haul COVID? Okay, we just talked about this. So the way it spreads, mostly airborne, right? And then you get it by breathing in this infected air, or if you're really in close contact with someone. It is less so spread by surfaces. Okay, so now what's the latest with COVID vaccines? Well, now that it's October, we have new updated guidance from NACI, which is the national body that gives guidance around vaccination. So Health Canada has approved two new vaccines or two updated COVID vaccines from Pfizer and Moderna. So these are targeting the latest variant, which is LP 8.1. And there's a Pfizer and Moderna version. If you are less than 5 years of age, you cannot get Pfizer, so you can only get the Moderna. And there's different doses for different age groups. So that's not really something you have to worry about as a patient. the person who is vaccinating you will definitely have the different doses for the different age groups, and they will make sure that you get the right one. Now, there's some people who, uh, there's a small minority of people who cannot have mRNA vaccines because they are deathly allergic to it, which means anaphylaxis, where your throat closes, this kind of thing. It's super, super rare. Um, those people prefer Novavax. Um, and Novavax is not available in Ontario this season. So the government did not procure this because there's such a small amount of people that this applies to. However, those people are still important, and for them, we need to have alternative ways of keeping them safe. So right now, the best we can do is, hand washing, masking, being in outdoor spaces rather than indoor spaces, avoiding crowded indoor spaces, and potentially going to a place where you can get vaccinated, which might be out of Ontario, just for getting that Novavax vaccine, if that's what you want to do. So that's an interesting scenario that a few people have found themselves in. And that's just what it is right now because Ontario does not have Novavax currently. Okay, so who should get a vaccine for COVID now? Well, the guidance is that if you're 65 and up, you should get it. It is strongly recommended. And for people who have these high risk group, who are in these high risk groups. And by the way, you can only get the COVID vaccine once you are 6 months of age and up, just like the flu vaccine, and not like before this. Okay, just to bring it full circle. So that's why it says those 6 months in age and older who are, but people who are less than 6 months of age should just not be getting COVID vaccines. So, uh, if you're part of these groups, then you are also strongly recommended because the benefit is definitely worth the risk. Now, what if you're not in those groups? Well, you are still advised to get the vaccine, but it is not a strong recommendation. As I said, we still want to prevent unnecessary infection and we want to prevent long haul COVID. And we know the vaccine is safe and effective. Does it make the incidence of COVID zero? No, it doesn't. It lowers the risk, but it does not eliminate the risk of COVID, which means that you could get the vaccine and then still get COVID later. That is very possible, but it will probably be milder if you are already vaccinated. So that's why we still recommend to get vaccinated. Okay, but it's not as strong of a recommendation as the elderly people in high risk groups. And this is a new guidance, this thing of 2 doses per year, fall and spring. So every 6 months for adults who are over 80 and people who are living in long-term care, seniors in long-term care, and people who are immunocompromised. Okay, because their immune systems are very, very, very vulnerable. So they should have every 6 months. Okay. Um, so just to bring things together, cold, COVID, and flu. These are some of the differences and similarities. I hope that this all makes sense from what I've discussed with you today. As you can see, cold is kind of like the mild thing that is not a big deal. But the flu and COVID, these things can hit you much harder. And for all of these, 3 plus RSV, we prevent them similarly in terms of our practices of hand washing and being mindful of who's sick and staying home and wearing masks at times, these kinds of things. And then there's vaccines for COVID, flu, and RSV. And it depends on your age group whether you should be getting this or not. But usually, yes. So again, this is a similar thing. I don't think we need to go into this because I want to get to our questions. Um, just so you know, again, for pregnancy, yes, all of these vaccines are safe in pregnancy. There's an inactivated flu vaccine, that's the default flu vaccine. And the COVID vaccine is also safe and recommended because then get these antibodies and you pass it through the placenta to the baby and provides protection to the baby once baby is born. And it also lowers the risk of mom getting sick while she's pregnant because that's an important thing to prevent because it would cause harm to the baby and increase the chance of complications. So, for more information, I would recommend you book with the VaxFax clinic. That is my clinic where you can talk one-on-one with a doctor and I can answer your questions. We'll also have a brief discussion or to answer your questions here. Um, but if you want to ask about your personal circumstances, your own medical conditions, medications, this kind of thing, um, it's probably better to do that in private. So shn.ca/vaxfax is the link to book an appointment. We talked about prevention. You know this. Hand washing. This is how you this is how you do it. Sanitizer is a good second choice. Dis Disinfect surfaces. You know this. Wear a mask when you need to. And this is what it looks like to book an appointment. And again, we can talk about anything as long as it's health related. The end. Thank you very much. I will stop sharing my screen and I will open this up for any questions you may have. I'm happy to answer them.
Wow. Thank you so much, Dr. Latif, for this incredible information. It's a lot to swallow, but always is we are the ambassador that we're going to be in the community, supporting our community, answer questions, and of course, if you can support them, we're going to refer to you to the Health Facts Plus. So, any one of the audience want to ask a question, feel free to unmute yourself and
Hi,
ask.
good afternoon, good evening. This is Maria Sultana. I have one question.
Yes,
So
go
I
ahead.
am okay. So when COVID started, that time I got third dose, first, second, third. I took everything. So I need to get another any COVID-19 vaccine or I'm fine.
So, okay, so I guess I'll just say this because it's gonna come up a lot. When someone says need to get, you don't, no one needs anything, right? Like you don't need to exercise, but it would help your health if you exercised, right? You don't like, you know what I mean? So I can't answer the question need to, but the question is, or the thing I can say is it recommended or not? Would it be, would it be helpful or harmful? Like, is the benefit worth the risk? It sounds like you said you have had 3 doses in your life. I don't
Yeah.
know when was your third dose?
When the COVID-19 vaccine is available, past term, maybe 3 years or 2 years ago.
Okay, so you have not had a vaccine in the past 2 years. Then
Yeah.
the next thing I would ask is if you've had a COVID infection recently.
No.
Okay, so basically, the last time your immune system was seeing something that looked like COVID was 2 years ago. So in that case, your immunity is like you've had some immunity because of those 3 doses, but some of it is waning, right? Some of those antibodies kind of swim away. And you might not have that strong level of immunity that you had right after your third dose. And the other thing is that the variant of COVID that is circulating has also changed from 2 years ago. So it also looks a little bit different. So your immune system might not recognize it as quickly if it encountered it. So what this means is that if you encountered COVID infection, right now, you are more likely to get infected than if you got vaccinated and then encountered the same infection, right? The same virus. So, yes, it would benefit you to get this vaccine much, much more than the risk of it harming you. Whether you fall into the strongly recommended group,
Mhm.
I don't know your age, and
So
these
I
can
have
change.
another question also. So it's very similar. So in the fall time, we know the every cold and sneezing, every virus are coming in the fall time. So which one is the most important? Flu vaccine or COVID-19 vaccine? Which one I will get?
I think you should get both. They're
Both?
both important, yes. And you get
Everybody,
them.
my baby also toddler?
Hold on a second. So I think you should get both. And I want to say while everyone's listening that because I think I forgot to say this, is that you can get them at the same time, the same day, same time. Ideally in
Oh,
different arms. But even then, the point is you can get them at the same time. And if you were in this rare situation where you were also eligible for the RSV vaccine and the flu vaccine and COVID vaccine, uh, and you could actually get all three at the same time.
how about my toddler?
What about your toddler?
She need any vaccine, COVID-19 or flu vaccine?
Yes. So how old is your toddler?
23 months.
Okay. So let's just think about the guidelines we just went over. So let's go over it. Okay. So flu vaccine, first of all, if you've never had a flu vaccine in your life and you are between the ages of 6 months and 9 years, you need to get two doses the first time, separated by 4 weeks. So has your toddler ever had a flu vaccine?
No.
Okay. Well, then you could get the first dose now and the second dose of flu vaccine in 4 weeks. So that's for the flu. Then let's go to COVID. Has your baby ever had COVID vaccine?
No.
Okay, well, they're eligible for the COVID vaccine, right? Because they're over 6 months of age. So then that would be the Moderna COVID vaccine. And then for RSV, does your toddler have are they high risk or are they healthy?
Healthy.
Okay, so then they do not need anything for RSV because it's only for babies who are less than a year old, unless they are high risk, then it goes up to 2 years old. But your baby's healthy, so they do not need anything. If they get RSV, they'll probably be okay because they're healthy and strong.
Okay, thank you.
You're welcome.
Lots of questions. Thank you so much.
No problem. A good
Um,
example.
okay, I have time for one question, and after we're gonna wrap up because I wanna be mindful of the time, your time, and everyone. So if someone already got Pfizer, Moderna last year, do they need to get this again?
Okay, thanks for this question, Rukmi. So this someone that you're talking about, uh, I would need to know about them, right? So uh, that would affect the answer. But overall, remember, everyone would benefit from this vaccine. This person, regardless if they're 30 years old or 90 years old, it sounds like it's been 1 year since their last dose. So they're already eligible for another dose. If they're older than 65, then it is strongly recommended, right? If they're younger than 65, then it is just recommended, but not as strongly. And then again, you asked, do they need to? And I will always say, no one needs to do anything. But should they? Will it benefit their health? Yes, it would benefit their health. It would lower their risk of COVID infection. It would lower their risk of long haul COVID. And if they have any other medical conditions or anything like that, then that's further increases the benefit from them to be protected.
Okay, great. Um, if anyone want to do a question, because we are running out of time, we can, Rugumi is gonna put her email address there, so in the chat, so you can contact her with any question. And I want to inform that CHC is doing a clinic in November. For now, we're gonna do flu. We are waiting for the Toronto Public Health and the COVID. We're gonna do two clinics. One is Saturday, 8 November, from 10 to 4. And the another one is going to be Wednesday 12 for 10 to 4. Keep on it because we're going to send the links in the media for registration, but also welcomes, walk-in are welcome. And any question that you have, we can contact us. I'm going to write my phone number here. And we can inform and help to register. My name is Mercedes. And also, it's not OHIP necessary. Obviously, it's free, and you can show another ID. It's for everyone. So, and I think it's done for now. I want to say thank you so much, Dr. Latif, for again, great presentation, information. Like always, I say knowledge is power. And thank you so much for the audience, for the questions. And please complete the survey. Don't forget to add your email address if you want to participate in the draw. Thank you so much, everyone, and enjoy the rest of the evening. Bye
Thank
for now.
you. Bye, everyone.
Bye.